Okay.
There we go.
All right.
We're
Ready?
recording?
Go ahead. We're recording.
All right.
And now everybody just froze.
Yeah, I'm like, she's talking.
It's Coach KJ, and we are here with Dr. Valentina. You're kind of sideways, I'm not sure, but it's Coach KJ, and we are here with the Moving Forward podcast, just once again with an exciting interview. We actually we host interviews with individuals to learn about what are some of the things that are needed in your journey to future awareness with health, life, and just plain old joy. We work with Mr. Some of the pathways that can be led for greater solutions, for better quality of life, just overall enjoyment. So once again, this is Coach KJ. I'm here with Dr. Valentina. Dr. Valentina, we have some great news.
Yes. Tell me.
Welcome. How are you tonight?
I'm doing great. Excited to be here. Excited for our guest.
Yes. And don't we have some great news?
I don't know what you're thinking of. What's in mind? What do you have?
I'm thinking of you coming to North Carolina, us finally meeting.
Yes, in person. So I will be there next week. I'm so excited. Like, it's going to be great. I just hope that this weather issue that's got your sound kind of somewhat choppy will be gone next week when I'm there, because I need it to be nice and sunny.
Yes. We went to Carolina today. I went with a friend to Carolina. We were walking, and I had on my cute little dress. You know, it's Carolina, blah blah blah. And she said, I think it's gonna rain. I said, oh no, we got this. So it started to rain. I said, oh, we can go across the street to Target and get umbrellas. Then it was a downpour. I went running, and my shoe popped off. I'm walking barefoot in the street. So yeah, so it was all of a sudden a torrential downpour. Yeah, it was funny. It was. I mean, it was. You know, I can laugh now, but you know,
Exactly.
bounce back people. But it's amazing to have friends that are like family, just have an opportunity to communicate with so many people. And the friend, her name's Felicia, she was so supportive during the process.
That's good. Oh, did she get kicked out?
Oh no, she did.
Okay. Oh, here she goes. Oh, that's so good. So I guess the weather is impacting the phones too.
Yeah.
Kelly,
Yeah.
it Coach KJ
So,
kicked you out, but you're back in.
I'm a fighter. I'm coming back.
I know
coming
that's
back.
right.
But we have someone really amazing that we're going to be interviewing tonight. Who has a true sense of family and support and communal gathering. So I brought up the whole thing about me and the family and the friend and etc. because I really wanted to introduce this amazing physician that we're about to interview. Her name is Dr. Marina Mitry-Hana, and she is a dual degree graduate from the University of St. Augustine for Health Sciences. She earned her Master's of Occupational Therapy in 2017 and her Doctorate of Physical Therapy in 2018. She's trained in providing a variety of treatments, including pre- and post-natal massage, pelvic therapy, dry needling, and red light therapy, and is also certified in LSVT for the treatment of Parkinson's disease. Dr. Marina Mitry-Hana has worked in multiple
I can't hear you, Coach.
have home health care and private clinics. Speaks fluent Arabic and basic Spanish. In her time, Dr. Marina Mitry-Hana volunteers pro bono work at a community clinic and also sits on the board of directors for Parkinson's Association of Greater Daytona Beach. She enjoys volunteering at children's camps and ARM, special needs conventions every year. Welcome, Dr. Marina Mitry-Hana. Is she on?
I
Yes.
am. Thank you, ladies. I'm so glad to be with you guys this evening, and I look forward to our discussion. We're going to be talking about some really cool things that I'm really passionate about tonight.
Yes.
Let's get started.
Yes. Is Coach, is she gone again?
Oh boy.
What a night. I suggested that we reschedule because,
Yeah.
okay, she's back. Coach,
Talk about some great. I'm not sure. I keep jumping out. We
it
talk
keeps
about some
kicking you
great
out.
things,
It must
and
be the weather.
it's got to be the weather. It's got to be the weather. So, but yes, we did talk about some great things. One of the things
Yeah.
that my mother always taught me is when you're looking for a clinician to interview them vertically and horizontally, like, learning about the clinician as a whole, not just so much of their degrees and stuff like that. And one of the things that I was really excited about was hearing your parents' philosophy of build a bigger table, so with a horizontal conversation. Tell me a little bit about.
Oh. It's
I'm
funny.
not sure what the question was. I think it's tell
She
me a
didn't
little
ask
bit
you
about how
to
I
ask
grew up.
it. Right.
Okay.
This must be some kind of like, what's that show? Punked or something. Okay.
Yeah, punked. Well,
Coach,
so
is it tell me a little bit about what was the rest of your question, Coach?
No, I said, during our conversation and while reading about your bio, you were telling me about your build a bigger, better table, and I'm build your table, and I always encourage people, as my mom encouraged me, to interview your doctors vertically as well as horizontally. Like, what motivates them, what gets them excited, what are some of their core values, as far as making sure that they're gonna, follow through with me and give me the best possible care. So I love that build a bigger table concept. Can you tell us a little bit about it?
well, so growing up, I grew up in a not so small town. It's like medium size. It's not a big city where the traffic's all crazy, but it's not
Mhm.
that small of a town. But it's still a very tight-knit community here. And when we moved to this community, my parents and my sisters and I, we were by ourselves. So we were no longer surrounded by our very large family. We were alone here. But the church community that we joined was very tight-knit and they became our family. And at that point,
Mhm.
our church was still very, very small and it was maybe 30 families. And
Okay.
through the years, as more and more people moved to the area and our community started to grow, it was, well, our family just got bigger.
Mm.
So our table gets bigger to accommodate these people.
Mm.
And my parents, I guess, going through the experience of being on their own and not being surrounded by their family, they pulled everybody into our house as, hey, we're your family, come in. And so, especially with like uh, single moms, single dads, single youth who were here on their own for college or like just moved to the area, got a new job, and they're here totally on their own. They have no family to go to for Thanksgiving or Christmas dinner or Easter Sunday or whatever. So it was always like, hey, there's a match on this afternoon, Sunday evening. Come on over to our house. And then I'd come home from church and there's like 15 people at the house. I'm like, who are all these people? Oh, they're new to the area.
I
Okay,
love
cool.
it.
So
That's beautiful.
everybody was always at our house, and those people, and that's just how my parents are. Like, oh, somebody needs help moving, we're gonna go help. Somebody needs help laying down new tile floors in their house, we're gonna go help. Uh,
Wow.
we're like, they're just whatever it is, we're gonna go help. And so, visiting the sick, visiting the elderly, what do they need help with? Somebody needs a ride to the doctor's appointment. Okay, we'll go take them. Just whatever we need to do to build that community of support because when we need help, they're there for us. And when
Mm.
they need help, we're there for them. And so we're all just trying to take care of each other. Having that circle of people that we could really rely on and we could help them, it's everybody just lifts each other up
Mm.
in
Mm.
times of struggle
I
and in
love it.
times of joy and in times of sadness. We were all there for each other all the time, even in just like, a potluck dinner.
Mm.
Everybody got up and helped clean from the little kids cleaning up the play area, the men cleaning up the grill and all the stuff outside, and the women kind of just grabbing everything in the kitchen. There's no dishes left for the hostess to stand there and wash.
Mm,
There's no trash to be picked up. There's nothing
mm.
left for them because we all just work together, get it done, 15 minutes, it's
Yeah.
all over. So it's just
Beautiful.
like having that
Let me
circle
ask
of
you
people
something.
that there are support you.
But let me ask you something. With
Mhm.
having those people, having different people from different environments, different backgrounds, different mindsets, etc. What did that type of eclectic environment do for you then and now? Like your perceptions of
Well,
things,
so
or
for the at that point, it was like we have my parents are actually both physical therapists also.
Mm.
So they would help people with their pain and their trouble walking and whatever they were having problems with. And one of them is a doctor. So when we're sick, we're going to go to him. And the other one is an accountant. So he's helping us make sure we're doing our finances correctly and our taxes. And the other one's a pharmacist. So he's making sure we're getting the right medications and nothing's interacting with each other. And he's keeping us taking the right stuff. So everybody, from their perspective and their profession and their side would help each other out. So we're kind of like trading
Wow.
off.
Wow.
And
Bartering.
growing up that way, I thought that was the norm.
Yeah.
So when I became an adult and now I'm out in the community and not everybody does that and not
Yeah.
everybody helps and not everybody has the same work ethic or the same uh
Like
supportive,
interpersonal. Yeah.
encouraging
Social.
interpersonal skills that
Yeah.
it was very eye-opening to me to like, oh, this is not the norm. Okay.
Yeah.
So
Yeah.
now I need to make
yeah,
sure that I choose my circle wisely.
Mm-hmm. Mm-hmm.
very
And you know
carefully.
what?
It's not. It sometimes it's not as much inclusive as it is kind of like an invitation, like making sure that
Right.
once again, you're with people with the same mindset because not everybody has the same mindset. I grew up in a
Hmm.
very nurturing household. You, Dr. Valentina, you grew up in a very nurturing household too, right?
Like for sure. Very, I mean, the concept of it takes a village was like just common sense for us.
Hmm.
It was something that
Hmm.
yeah, I mean, and what was cool about it is your neighbors could discipline you, like, you know what I mean?
Yeah.
Because they were like family. So that's, I think, part of what made it like the whole like cohesion to ensure that people aren't
Hmm.
hurting each other and stealing from each other because you're accountable to each other. You
Yes.
know, it's beautiful. But it's interesting
Yeah.
'cause you saying that, doctor, had me thinking about, what my husband said, which is, we have to like really think of the people that we come across in college as like our network, like start building it already. Because
Hmm.
person that is your dorm mate or that was down the hall from you, in the dorms, or that is a classmate could end up being your accountant or an attorney in
Hmm.
this case, or,
Hmm.
medical doctor in that one. So in the end, that's almost like how you have to do it. But ideally, right, it would be there on your block and you're all sort of engaging in this type of bartering, family
Yeah,
system.
exactly.
But
Mm.
one of the challenges with that is that people are so busy nowadays, and people are trying so hard to, fill in gaps versus, during that time period, it was more of a process. And now it's more of an urgency. It's more of a quick fix. And
Mm.
so I
Hmm.
was wondering with some of the quick fix solutions, how does that impact you and your practice? Or are you seeing something different? I mean, do people have the patience to go to physical therapy? Are people taking longer to get to physical therapy? Like, what are you seeing with regards to the quick fix?
Mm.
And
Yes.
you know what I mean?
Our culture, yes,
Yeah,
absolutely.
instant
Our culture
gratification.
today has definitely really pushed that idea of everything we just want. I need it working and I need it now. And it's like we have no patience for anything. Even
Mm.
like on our phones and looking at a video, if it doesn't get to the point within 15 seconds, I'm not watching the rest of it.
Mm.
Right? It's like we need that instant gratification all the time. And people expect the same thing with your body. So I explain to my patients a lot, this problem, this pain in your back, how long have you been dealing with it? Oh, it's been on and off for 10, 15 years now. I'm like, okay. So it's developed over many, many, many years. The solution is not going to develop in a week. The solution is going to take time because the solution is we need to
Mhm.
change a lot of habits. A
Right.
lot of times, a lot of the problems that we're experiencing within our bodies is
Mhm.
because of habits that we've developed, mental health,
Mhm.
nutrition, exercise, just as in general movement, that sedentary lifestyle that we've
Mm.
become so ingrained in this society where everything we do is sitting down.
Yeah.
So it's there's a lot of retraining that we have to do, and that starts with me, even myself. Going through grad school, I spent 8 hours a day in classes, and then I had 2.5 hours of driving back and forth each day because I had a
Wow.
very long commute. And then I have to come home and I'm going to sit down and eat dinner. And then I'm going to sit down at my desk and study for another 3 hours. So there's a lot
Wow.
of sitting down. I have to purposely force myself and break that habit and get into I need to exercise, I need to move, I need to make
Right.
sure I'm eating healthy for my brain to understand everything that I'm doing and to keep my body going because grad school is very, very stressful. I'm sure you can remember. Um, but as our patients come in with this, yeah, a lot of them, there is a bit of a delay in people coming to PT sometimes because
Mm.
they just don't know. They don't know what PT
Mm.
can do for them. They don't know just how broad the scope of PT actually is.
Mhm.
They're like, oh, well, you're just going to help me with my knee after I have surgery. I'm like, no, actually, we treat a lot of things from head to toe. I can treat a person who has hammer toes and help them avoid surgery. I can treat a person with TMJ issues, that's the jaw.
Okay.
We can treat people with neurological conditions. We can treat people in cardiac rehab. We can treat children. We can work in the hospitals. We can work in the school setting. We can work in the home. We can work in early intervention, Head Start programs. Like there's
Mm.
such a broad scope of what PT can do. And a lot of people don't realize that. Even pelvic health is
Yeah.
an very rapidly growing area with PT right now because it's like people have just finally realized that, oh my God, a PT can actually help me with my incontinence. Yeah,
Wow.
we
That makes
can.
sense though. That makes sense though.
Yeah, because that's all controlled by the muscles in your pelvis. So
Yeah. You know
there's a
what?
lot of
Even what
things
you're
that
saying
people just
about the
don't know.
children, even what you're saying about the infants, like I think you said Head Start or birth to three. I had a client
Hmm.
and I had no idea like that this baby was able to go to PT because he couldn't like
Yeah.
put his head or it was something about the birth process that required, or maybe like because I got a couple different clients that accessed it,
Hmm.
when their child was a baby.
Yeah.
Um, like I think they was born with like the certain foot. Um, you know what I mean? It was
They were
some
born in an awkward position, so it
yeah.
injured a limb, or sometimes it
Yep.
injures like actually I treated a young woman who had a birth injury to her arm, and it injured the nerve so that one arm doesn't work as well as the
Mm,
other.
mm,
And she had gone through her whole life with that. She had
mm,
been to previous therapy sessions before, and she was doing really well. And she went for
mhm,
a long time without having to go through therapy. But then, like insurance issues and whatever reasons,
mm.
she started having some regressions and wasn't able to get into treatments. And then her elbow contracted
Wow.
and is like stuck with only about 30 degrees of range. And that's as
Mobility.
far as
Yeah.
she can get.
Wow.
But working with that, like that was one of my actually that was one of the pushes that I had when I was doing observations and volunteer work before I went to PT school. There
Mm,
was this young mom that we were working with, and she had a baby who
okay.
hypotonic, so the baby's
Mm,
muscles were not very strong. They were missing a lot of milestones, and the baby was 6 or 7 months old already and still could not pick up their head.
wow. Yes.
And
Yes.
so we were working with her and with the baby. And the first time that that baby picked up its head and
Wow.
looked at its mom and smiled, she
Wow.
started crying and I started crying. And then it's
Wow.
like,
Yes.
okay, I know I'm on the right path here.
Yes. Wow. Wow.
Wow. So that's something that happens with the infants. I was reading that there was something with
Mm,
SSRIs that could
mhm,
potentially even help. I'm sorry, could potentially even impact young adults.
mm.
Do you work with that?
Not very often. Most of my work is with the elderly, but when I was doing some internships, we were working with did have one pediatric internship, and boy, that was really eye-opening. The
Mm,
medications that these children take for a lot of their diagnoses have so many side effects.
mhm.
And it is really difficult for parents to decipher, is what my
Yeah,
child is experiencing right now a side effect to the medication, or is this a part of their condition?
right.
And it was really difficult for them to figure out, like, do I need to be talking to my doctor about this? So what I
Mhm,
would tell the parents to do sometimes is to keep a journal
mhm,
and try to see patterns
mhm,
in the symptoms or side effects or their behaviors. Like if they're constantly exhibiting this pain in their legs and they're having more trouble walking and they're being more stiff, and
mhm.
that always happens an hour or two after taking the medication,
Mm,
then that's going to have me thinking that it's a side
Mm.
effect of the medications.
okay.
If
Is
there's
that
no
tardive dyskinesia?
decipherable pattern, then it may be because of something else. So it's a lot of like detective work that
Yeah,
between the parents and the doctors and the therapists and the child needing to kind of really dissect the symptoms and the responses that they're having
yeah,
to be able to figure out, okay, which path is it actually going along.
yeah. Yeah, I know some clients who so that's first of all some great advice because that will help in the cases that my clients have experienced, which is they will go to the medical doctors and what they will be told would basically dismiss. It would be dismissive, right? It would be like, no, that's it's like, oh, your child's depressed, so you're taking this SSRI, this
Hmm.
antidepressant and it comes with suicidal thoughts and it's like well yeah that's a part of depression and it's like but
Yeah,
the child
so isn't
isn't
that great? It's like
experiencing
one of the
that
adverse side effects of antidepressants is suicidal thoughts.
suicidal
Like,
ideation.
that
How
doesn't
does that
make
make
sense.
sense? Exactly, exactly.
Okay.
I agree. And so giving my clients the advice that you gave yours, which is to document how maybe the problem with SSRIs though is I feel like that's one of those meds unlike a certain type of anxiety med, like the PAMs,
Hmm.
and the LAMs, the one the N and AM that you take
Hmm.
as needed. These actually are in your system, or like different
They
from
have to be taken
antidepressants.
regularly all the time, and they take so
Exactly.
long to actually show their effect.
Right.
And
That
even when
then you
somebody
don't
wants to come off of it, they have to
exactly
slowly wean off.
paper. That's it. That's it.
Yeah.
And so that's the problem. It's like even if you don't take it today, you could still have this. It's in your system because you've been
Hmm.
taking it for months. And
Right.
so it's
Right.
almost just like you need to then change docs and have somebody who is willing to really listen to you
To
because
really, really
you're
actually figure out
right.
why. So one thing I learned from a really good, actually, this was one of the servants in our youth group when I was young.
Hmm.
He was telling us a story about somebody trying to fix something on an airplane. He's an engineer.
Okay.
And he's like, well, before you come up with any solution, you need to ask why this problem is happening.
Yes.
And you need
Exactly.
to ask why at least 5 times.
Okay. Wow. Wow.
Because, okay, so for example, I don't remember the exact metaphor he used with the airplane, but it was like, okay, something's wrong with the engine. Okay, it was this piece that's not spinning. Okay, why is it not spinning? And then it was like the gear behind this is not spinning.
Exactly.
Or and then it was like you just keep going until you
Exactly.
figure out the root cause. So like you
Exactly.
what in the professional world they call a root cause analysis. Essentially
Yeah.
that's what you're doing. So when you have a child who's depressed, why? What's
Exactly.
going on in their life? Before I start giving chemical solutions,
Yes.
let's
Wow.
understand the root cause because it may not be what we thought it was. There may
Yeah,
be
talking about
something behind it.
their serotonin is low. They're low in dopamine, but still why? Because if it's trauma,
But
then
here's
no
my
matter
thing.
what you're giving them, it's not fixing a problem. And that's why you could be on antidepressants and still be very much so
And it's not
struggling with
working
depression because it's not taking away the issue.
because sometimes,
Mhm.
and a lot of times, doctors prescribe medications based off of what you've told them in the span of 5 minutes.
Come on.
And they haven't done the proper blood work
Yes.
to
Yeah.
understand. And especially when you're talking about
Mhm.
their mental health and drugs like SSRIs or anything that it affects the chemicals of the brain, to me, that's just like, how would you prescribe medication without
Mhm.
first having done a neurotransmitter panel to really
Wow.
see, are these neurotransmitters actually off? Is their serotonin
Wow.
actually low? Is it the
Wow.
dopamine? Is it this? Like, what are you prescribing medications based off of?
Yeah, because it could have been, about the
There's
vitamin
no
D
objective data
deficiency.
telling you that.
Yeah, there's all type of, so I learned about it seemed like a lot of people started understanding in the medical community the impact of COVID being inside,
Mhm.
right there
Yes.
on then vitamin D deficiencies. But and so
Mhm.
they started
Mhm.
prescribing that. But um we learned about as a certified mental health integrated medicine provider added to the PsyD,
Mhm.
that you should probably be getting some kind of organics lab test to really look at like what are you deficient in, because you could be deficient
Yes.
in magnesium and that could impact your depression or anxiety.
Yes.
You could have
Yes.
issues with um your thyroid, and that could impact anxiety or depression depending on if it's hypo or hyper. And then the same
Exactly.
thing with I just think of nutrients. You could have an excess of lead,
Mhm.
which they would call ADHD, when really no.
Mhm.
You can balance it just like with copper. You can balance it with what I've learned, zinc,
Yeah.
and you won't look aggressive or inattentive and ADHD-ish, So it's
Mhm.
important, like,
Yeah.
to get at the root etiology, right, cause of the issue, because if you don't,
Exactly.
you're gonna call it something like Coach KJ was talking about and misdiagnose, and that's gonna consequently result in mistreatment, mislabeling,
Exactly.
you know?
Yeah. Yep.
Coach got kicked off again. She keeps coming on, and it keeps kicking her off. She literally hasn't been able to get a word in because it keeps kicking
Oh
her
my
off. It's a
goodness.
trip. Here we go. Hopefully, she'll be able to get a word in because I know she has a list of
For whether
questions.
we're all to get for whether or not we're on the same page. And what I find is that
Yes.
sometimes kids don't really understand what's the core of their challenge, or they may mask the core of their challenge because they don't want to be a pain, they don't want to be a wimp, they don't want to be a
Mhm.
punk, they don't want to be all these other kind of things. So even when doctors are prescribing or diagnosing, they can have a challenge with understanding what the proper diagnosis is because the kids are not revealing the
Wow.
true components of what's
Right.
going on. And as I say in my book, I continuously say there's 525,600 minutes in a year. You know more than your teacher, your clinician, your coworker, or anybody else. You know the context of the challenge. And so if
Mm.
individuals are not willing to give the context of
See, kicked her out. She's saying, right, if they can't basically speak to what they're going through, how would you really know what it is?
Right.
That was
And what
good,
they need to
Coach.
help them
exactly
fix it.
Yeah, that was really good. Yeah, you're right about that, Coach, because I have a client who, when he came to me, he was already on the drugs. And I think part of what medical doctors go through that makes it hard for them too is that people come to them in crisis and they are looking in some cases for, that you have the good doctors who really don't want to prescribe, but are also
Mhm.
like not, I guess, they don't have a list because of maybe what institution they're affiliated with of psychologists or therapists that they can send the person to. And so
Mhm.
I think they feel like there's pressure to kind of solve the problem, but they should kind of take a book out of your, what is it, a page out of your book, doctor, and right, and say, hey, like in the end, we need to get to the root cause of this issue. We need to know what's
Mhm.
going on. Because I'm just concerned that part of why they diagnose is this instant gratification. People want an answer, they want a solution, they want it now.
Mhm.
They're being
Yeah.
rewarded for it too.
microwave.
Yep, exactly.
That's the microwave situation I was talking about in the beginning.
Yep,
Yeah.
yep. It's so true. Yeah, but he came saying that he was diagnosed already with ADHD, happened to be the incorrect diagnosis, and so we was able to straighten all that
Mm.
out through neuropsychological testing, found out that it was learning disorder, but that it could present. And in other cases, they thought it was ADHD and it was like trauma, so but
Oh, wow.
his medication wasn't to help, right? In his mind, he didn't know that it was attached to attention. He thought that it was attached to behavior. So it's sad.
Mm.
Children think, they associate
Mm-hmm.
that they're taking this because they're bad, they're disruptive, you know?
Yeah. Yep.
Sad.
Challenge thing. Remember that I can't remember her name, but there was a blue-eyed, brown-eyed test, Jane
Oh yeah,
something, and it was more or less if they teach the kids that they're bad, then they're going to be bad.
yeah.
And I come across a lot of individuals, teens and adults,
Mhm. Mm,
whereas all their life they were told negative things.
mm,
And so when they get to a certain point, they're like, well, I'm not fulfilled because I'm not reaching my goal, I'm not reaching my dream. I don't have the capabilities because of
Mm-hmm.
all the things I was told that I can't do. So how do I move forward? Right? And how do we help people to track their successes and the good things so that when they come to a clinician, they're more
yeah.
prepared to tell you where they'd like to be versus
Mm, Okay, she got kicked off, but I think I know where she's going. Is there any way oh wait, she's coming back on. Because I was gonna say I would love, just based on where she's going.
dessert.
There you go. There you go. Okay.
I would
You kicked you off.
I was just I was just gonna say really quickly, I would
Yeah.
love to see people go into the clinician looking for the baked Alaska, which is I don't know if it can take like 9 hours to make a baked Alaska. It takes a very, very long time versus just looking for, Kool-Aid where you just add the
Mm,
sugar and stir. You know?
Uh-huh.
mm,
Yes.
Oh,
Yep. We do actually deal with that a lot. And it's really difficult to kind of change somebody's mindset, but that's what it all comes down
yeah.
to is your mindset.
Yeah.
And especially when I worked in the hospital and in the acute care and in the post-acute rehab floors, and it was just like the people who had a more positive attitude and a more positive mindset and understanding that, hey, it's going to be a long road, but I'm taking it step by step. Today, I was able to accomplish this, and that's huge.
Yeah.
Tomorrow, I'm going to try to do this. And then
Yeah.
just taking it slow and really focusing and emphasizing and making sure that I'm bringing the positives to the forefront instead of, like you said, people are constantly being told the negative.
Mm,
It puts them down even more. And that's true for every living organism on this planet.
that's
I mean,
true.
it's research has even showed that that's true for plants. If
Wow,
you
that's
talk to your
true.
plants
Isn't that crazy?
with
I mean,
positive reinforcement and
yeah,
then they talk to a different plant with negative comments
yeah,
and that plant died and this plant thrived.
that's
So the
craziness.
fact that that happens on that level just tells you how
Um,
much more it affects a conscious cognitive being like a human.
yeah,
So your mindset and your outlook plays a huge role in your progression and your recovery,
yeah,
whether that's from an orthopedic injury or a neurological one or just a mental one. It's
yeah,
it's a lot of how you perceive yourself and how you
yeah.
perceive your progress. I
That's
had a
big.
patient who
and
at the
Doc-
hospital, yes.
I was just say the only thing I was gonna say really quickly is you said something earlier about that where you were talking about your inner circle and getting the right circle. I don't know if my phone's
Hmm.
gonna click off again, but
Yeah. She's like, I
Probably.
don't know if my
Okay.
call's gonna go out and then boom.
I
Um,
think what she's probably
tell
trying
me.
to get at is how much
Okay.
your circle makes a difference with that. And it absolutely
Yeah,
does. Because if your circle are people who are like, oh, you're stuck in this rut, you're probably never going to be able to get out of this. You should really just accept where you are. And that's as far as you're going to get and just deal with this because this isn't going to get any better. You're not going to get better.
exactly.
But if your
right.
circle is lifting you up and, hey, look what you did today, that's
Yeah.
amazing.
Yes.
And just keeps encouraging you. Like I have a couple of friends who no matter how messy my house is, they're welcome.
Yeah, yeah,
Let me tell you, I've got 2 kids and 2 dogs, and they're all in sports, and there's like dirt and mud in the house all the time. And
yeah,
there's 3 baskets of laundry sitting on my dining room table. Whatever. This
yeah,
is me. This is our house. We're a functioning family. Like we're
yeah,
all busy, and they get that. And
yeah,
that's my circle. And they can come in and we just sit on the back porch and have a cup of tea together and watch the
yeah,
sunset over the lake. And
yes,
it's great. And
yeah,
that to me is more uplifting than seeing 30 other people who are going to just sit there and,
yeah,
whatever.
exactly.
Your circle has a big part in your mindset,
That's right. Well, it
and your
makes sense though.
mindset
Think about it.
controls your recovery because
Right.
mental stress
Yeah,
manifests in physical symptoms
that's
100%.
That's well, right. Think about all the people who walk into the ER thinking they have a heart attack and is instead panicked,
It's stress.
anxiety,
Mm-hmm.
So, but
Yep.
you're right about the people that you have around you. They will help make or break you. In the end,
Mm-hmm.
you know about what the research says about having at least one positive person in your life as
Yep.
a child, and what it does to your, does your ability even to like
Mm-hmm.
to go for some kind of career. So you
Yeah.
are totally right. Now we're towards the end, and so what I would love for you to share, and you share some really, like, I'm talking really good things, is what, like, maybe what could you advise or encourage, educate clients on, like, doing, or like whether it's how to advocate for themselves or how to identify when maybe PT is the best for them to seek out. So you are a doctor in OT and you have your PT degree?
I have my doctorate in PT and my master's in OT.
Okay, there you go. See, I had it flipped in my mind.
That's
So
okay.
yeah, like when is it a good time for them to seek that? Help them understand because I think sometimes people associate PT with like, an accident. And like you said, it could be something that they was born with all their life that they just accepted as what it is and come to find out
Yeah.
it didn't have to be that way.
It doesn't have to be that way. One of the big things that we're really pushing now is women's health, uh, incontinence, stress incontinence, urgency, all that kind of stuff. And for men also,
Yeah,
common does not equal normal.
that's right. That's right.
I
At
like
no
that. I
point
like
in
that.
your life, other than infancy, is it normal for you to lose control of your bowel or bladder.
Okay.
At no point other than infancy
That's right.
should
That's
you have that happening. It is common that women experience those symptoms after childbirth or surgery or even spinal cord injury, or men after prostate. But that's something that we can work on. It's something that is treatable. It is not something that you have to continue living with for the rest of your life.
right. Just accept my
Pain,
diapers. Like,
also.
no.
Yeah, it's
Yeah.
absolutely not. Pain is not something that you should be living with for the rest of your life. Pain is your body's way of telling you that something is wrong.
Okay. So it's not
R-
affiliated with just old age because you're saying they could be stretching. It could be another thing. What can people do? Even some easy, like not necessarily easy, but something that they can do in their home, something that you would prescribe as homework.
Mhm. So for pain, it's a matter of what kind of pain. And this is when my patients come in and they're telling me, "Oh, I've been having pain. Where is it coming from? Oh, my doctor said it's peripheral neuropathy. Tell me more." Because what kind of pain it is will help me figure out where it's actually coming from. If it's
Mm,
burning, or is it tingling? Is it numb? Are you feeling pins and
mm,
needles? Are you feeling sharp shocks? Are you
mm,
feeling this dull throbbing aching?
mm.
Is it shooting? Is it just staying in one place? All those
Wow.
kinds of things help us figure out, okay, is this a mechanical issue? Is there an impingement? Is there just inflammation in the joint? Is it a joint restriction, or is it just arthritis? Arthritis
Mm,
is one of the very common diagnoses that we deal with. Unfortunately, there is no cure for arthritis. It's damage that's been done to the joint. You've worn away the cartilage surfaces on the joint. We can't reverse that. But what we can do is help improve the joint's mobility and help take some pressure off and help our patients learn how to stretch and how to move to protect the remaining cartilage and help them
mm.
stay mobile. so that the
Yeah.
arthritis doesn't continue to progress. Um, if you're experiencing symptoms and nothing is improving and you're seeing one doctor, I recommend go seeing a second opinion.
Yeah.
Like Kelly was saying earlier, interview your doctors, figure out
Yeah.
how they work, because some doctors, and this is true in every profession, doctors, mechanics,
Yeah.
uh plumbers, electricians, some of them are really good. Some of them are not so good.
Mm-hmm.
Some of them are the ones who were like straight A students. They knew their stuff. They've got it down. And some of them are the ones who barely skated by with a C and they
Mm-hmm.
barely graduated. I
Mm-hmm.
want the one who continues to learn. Every
Yeah.
one of those professions, especially in the medical field, we all have to do continuing education. We
Yeah.
all have to continue to learn new things that are being researched and found in each of those fields. So if these people are not keeping up to date and they're using the most outdated modalities and treatment techniques, then I'm going to go look elsewhere
Okay.
and find someone else who is keeping up with the research, who is looking at, well, what alternative treatments are there? I'm going to look for somebody whose first reaction is to, okay, let's figure out why, and not to just give me a steroid pack.
Exactly. Exactly.
Right.
Right. And
I always
and
say that's
somebody
like the,
go ahead, coach.
no, you go.
I was just thinking, in the end, somebody who's also willing, like they're hearing out your approach to things. If they get to know you, then they'll realize what is an appropriate or an inappropriate like treatment option. And so, why give me, a steroid pack or some kind of chemical when you're seeing that the way I talk is all around
Yeah.
naturopathic? Hear
Yeah.
me. That's respect right there versus using your power over me.
Yeah.
You know what I'm saying? But yeah, and then I was thinking too, so in the end, it just sounds like people need to continue to work on their mobility because restricted mobility can lead to pain. Then I think another good potential, so stretching, right? And I think another potential,
Stretching and just
right,
movement. Get up and walk.
right.
Motion is lotion for your joints.
Mm,
Movement is
Oh, I like
medicine.
that motion.
yeah.
I got the motion and the lotion. The common doesn't
Motion is
equal
lotion
normal.
for
What?
your joints. That's actually from one of my grad school professors. I can't
That's
claim credit for that
perfect.
one, but it
He
always
or
stuck
she
with
is
me.
genius. And then
Yeah.
wouldn't it
Wow.
be good advice to also encourage people to seek some kind of physical therapy or occupational therapy evaluation? Like you may not need therapy, but if you don't know that you need it or not, then seek an evaluation, which is the preliminary
Yes.
like assessment to determine if you would be a good candidate for therapy. That way you're
Yes.
having to figure, and then of course the difference between OT and PT, because I think a lot of people mix them up, is like,
Yeah.
PT is there's typically some kind of actual injury, right? Versus OT, it's
Well, so the scope of practice for PT and OT, there is some overlap between the two, but OT is more focused on a patient's
Fine motor.
independence and
mm,
quality of life, depending on the setting. Like with pediatrics, it's going to be a bit more of their fine motor coordination, self-care, that kind of stuff. And in the hospital as well, it's going to be more focused on their self-care and independence to be able to function in the home. We do help people with a lot of adaptive equipment with OT. PT is more on your gait and mobility, and I mean, they both work on strength, they both work on balance, but it depends on what the overall goal is, and the techniques and interventions that they use to get there are going to be different.
okay.
I just wanted to bring up one thing really quickly, and
Mhm.
we were talking about this beforehand before you got on, Dr. Valentina. The Dr. Mitry-Hana. Did I say that right?
Yeah.
Okay, Dr. Mitry-Hana also works with Parkinson's disease, and my dad had Parkinson's, so I'm always interested in hearing more and more about Parkinson's. And I learned about the proprioceptive and perceptive challenges with that. The reason why I wanted to bring that up is because when I was reading about it, studying it with regards to my dad, the ages for the onset of Parkinson's can be between 20 to 60 years old. It's, just depends. But there was a recent study, I think it was like in 2017, or a recent case in 2017, of a young person age 12 that
Ooh.
had it's called young onset Parkinson's disease. So with that being said, I was wondering if you could just tell us what some of the key symptoms or warning signs are, you know, for people who are not expecting it. So if your child's 12 years old and you go to the doctors, they're not going to say Parkinson's because that's not the tradition. That's not, I mean, that's
Yeah,
not
that's a very much
the
an
norm.
outlier.
Yeah.
It's typically in much older patients. But the typical symptoms, and Parkinson's is a progressive disease, and unfortunately, there is no known cure. But it is usually begins with, basically, if you think of Parkinson's, is everything shrinks down.
Mm.
Their gait, they start taking smaller steps, they're shuffling, they're not picking up their feet, their handwriting becomes smaller and almost illegible, their voice lowers, their movements in general,
Wow.
like
Wow.
everything just quiets and calms down and just pulls in. And that includes their muscles, their
Wow.
GI function, their cognition. Like a
Wow.
lot of things will start kind of being affected through the body, and just kind of shrinking and pulling in is kind of where it usually, what most
Mm.
people will start seeing. The And it's not just one side of the body, it's both sides.
Mm-hmm.
Whereas like
When you say
something like
cognition, is
stroke,
that
for
repetitiveness?
example, a lot of the patients that we see with Parkinson's, a lot of them have dementia.
Mm. Mm-hmm.
Several of the patients I've been treating with Parkinson's have dementia of varying levels.
Mm-hmm.
And as the disease progresses, it just becomes so devastating to their function, and they become completely dependent on their caregivers. So early diagnosis and early intervention is super important with something like Parkinson's. Recent studies are finding new ways and blood test markers to be able to find the diagnoses more accurately, and the treatments are improving a little bit more. The main medication is still carbidopa levodopa, but there's other medications that are coming out to kind of supplement that and help it become more effective. But starting PT and OT early on is been very helpful in keeping them as mobile and as independent as possible for as long as possible to reduce the burden of care on their caregivers. So the other thing is, like, I actually did a little bit of research on some Parkinson's patients when I was in my grad school, and we did a little class with mindfulness and just did like a guided imagery thing, and doing like just calm, deep breathing and relaxation and all of that. The patient's wife came in the next day, called in the next day, I mean, and told us that he hasn't slept that well in months.
Mm.
So just doing very calming, deep breathing things, and that goes for everybody, not just Parkinson's. Calming, deep diaphragmatic breathing helps calm the nervous system, helps calm the heart, helps calm your brain, it helps calm anxiety, helps calm a lot of things when we just focus on deep intentional breathing. And that's actually
Wow.
one of
This
the
is
first things that I treat in people and that come into our clinic, and realize, wow, people really don't know how to breathe correctly. And then I
Yeah.
spend an entire 45-minute session just teaching them how to breathe.
Doing therapy. That's how
Yeah.
it is.
powerful.
That's how it is. It's in everything.
Yeah.
Yeah,
And then
well,
my patients are like, you're my therapist and you're my therapist.
Yeah, exactly. Exactly.
another
He's
degree,
no, no,
another
no.
degree.
We have
And they're like, are you going to get another degree? I'm
right,
like, no, two is enough.
right,
Well,
right.
listen, this has been so powerful and so
Yeah.
insightful.
Thank
Just
you.
the insight that you provided. What I'd like to do is, before we close out, is just give you an opportunity to say anything else that we may have not asked you that you would like to leave for our listeners. Once again, you know, people may not know that they need a physical therapist, and this is just one of those nuggets to give people more insight. So, what would you like to share with our listeners so that they can learn more about PT, and you know, also what's your contact information and how can they contact you, your practice,
Yeah.
that kind
finding a good physical therapist is very important. Just like every other profession, like we said, there's good ones and there's not so good ones. Most of the good, really, really good ones who are going to be able to help you in the way that you need don't work in those mill clinics. They work in private owned facilities where they're able to really work with the patients the way we need to. When therapists are stuck in these corporate offices, they are seeing 2 and 3 patients at a time. They're just moving one patient from one machine to another, and then they've got another patient over here, and they're doing that's not good therapy. If that's been your previous experience with physical therapy, please, I urge you to find somewhere else, because that's not the right way to practice. That's not how PTs want to practice. If we all had an ideal setting, we would be seeing all of our patients one-on-one. Finding a private owned clinic where they are seeing you one-on-one and doing hands-on manual therapy, that's where you need to be going. And if you're with someone, whether it's a PT or an OT or a speech therapist or a physician or a psychologist or a chiropractor or a mechanic or a plumber, if you're with somebody who's not listening to what you're saying, please get a second opinion and go find someone else who will help you. Don't settle for someone who is not treating you the right way that your body needs. You know your body. You're in your body 24/7. They are not. So listen to what your body is telling you. It will let you know the right direction to go in.
That's right. Wow. Thank you
And
so
I know we
much.
didn't get a chance to get into your personal, story, but she's speaking firsthand because she did go to a physical therapist where she did not receive results. She went to a massage where a masseuse where she only saw temporary results, but then she went to another physical therapist and they were and get a second opinion and find the right doctor. She's speaking from personal experience. Doctor, something, a nugget that you learned from tonight that you weren't expecting, and it's very insightful. It's something that you might even share within your practice or just with friends and family. But what is something that you got out of this interview tonight?
You said for me, you broke up, Kelly.
Oh, I'm sorry. I
Did you
said,
say
Dr.
I
Valentina,
figured you
what is
said for me because you just
right?
asked her.
Right.
For sure. In the end, like this piece about documenting your experiences, the symptoms when it's happening. Although I don't know if it'll be enough, because I feel like if a medical provider in the end is already discounting what a client is concerned about when talking about symptoms that come from, antidepressants, or anti-anxiety or or psychostimulants, antipsychotic, whatever it is, I think in the end it's all about second opinion. So definitely, you know, keeping that going.
Wow. Once again, I thank you. I learned that we have to keep track of our activity and any type of progression, so that way we can effectively report that to our doctor so that we can effectively get the right diagnosis. I learned about find your inner circle, your circle of support, because it's your mindset as to how well you will proceed or how your success from the with the recovery. I learned common does not equal normal, and that also motion is your lotion. So I thank you so much for everything. I thank both of you for a wonderful night and a wonderful discussion about physical therapy and just how to keep moving forward. All right. Just wanted to say good night to everybody. Dr.
All right,
Mitry-Hana, are you
ladies, good
still
night, and
on?
Thank you.
Hi, doctor.
Thank you.
Bye.
Good night, everyone.
Good night.